And so key symptoms that I'm looking at, this person has about 75 different symptoms, but I'm picking up a malarial pathogen. I'm picking up Babesia. And the reason why I'm picking up Babesia is because I'm seeing things like sharp pain in the chest. That's a Babesia type of symptom. Sensations of shards of glass in the body. That's also Babesia. Feels like the body's on fire. That can be Babesia and or Bartonella. So Bartonella is also another malarial type of pathogen. Nosebleeds, Babesia and or Bartonella pathogen. Bruises easily, Babesia or Bartonella. So Babesia, Bartonella, these two pathogens, they get into the vascular tissue. And the spleen is also weak. And when the spleen is weak, then the integrity of the vessels are are shot. And so when people get bumped, it's easier for them to get bruised. Hair loss. Hair loss could be a malarial type of infection. And I say could, but it points to the possibility of that direction. So we're going to highlight it. And the reason why is because malarial type of infections get into the red blood cells. They consume our iron, oxygen, and hemoglobin. Iron becomes deficient. One of the first things that's going to happen with iron deficiency is hair loss because iron is needed everywhere in the body. And so the body starts to consider, okay, what's not needed so everything else can have its sufficient iron. And so the hair is not needed. And so then the hair goes, and that's one of the reasons why people can get hair loss. Doesn't have to be the reason, but it's something to consider. This patient has drenching night sweats. That's also malarial infection, Babesia and or Bartonella. Calf cramping, Babesia and or Bartonella. Typical symptoms of Babesia and Bartonella. Gripping, aching, pain in the chest region. Same, Babesia, Bartonella. Ear pain, tinnitus. Same, Babesia and or Bartonella. That could also be Lyme disease, Borrelia infection. That could be an array of different types of infections causing ear pain and tinnitus. But Babesia and Bartonella is one of those. Shortness of breath often. That is a classic malarial type of presentation. Air hunger, shortness of breath. So what's happening is the oxygen in the red blood cells are being consumed. And so when that happens, people have this air hunger. They're not getting enough oxygen. And so they have shortness of breath, they have air hunger, they're trying to get more oxygen because the pathogen is consuming the oxygen in the red blood cells. So that's why people get shortness of breath. And shortness of breath follows with anxiety. When people don't have enough oxygen in the blood, they get anxiety and they also get tachycardia. And the reason why they have tachycardia is because the heart rate needs to move what little oxygen it does have to everywhere in the body. When there's not enough red blood cells, carrying enough supply of oxygen due to pathogenic involvement getting into the red blood cells, then the heart rate increases. So it can deliver what oxygen it does have everywhere in the body to keep the body functioning in the best way that it can. Difficulty swallowing, that's not necessarily, doesn't have to be a Babesia or Bartonella infection. Episodic tachycardia, definitely. Skipped beat, commonly. Pain between the shoulder blades and the back of the neck, underneath the ribs on both sides, serious pain in the abdomen. That's commonly Babesia. It could be anything, but commonly Babesia. Slow urinary flow, can't control the muscles to pee, numbness and tingling in the fingers and the feet. That could be anything. Sharp shooting electrical pains. Whenever you see electrical pains, that's likely Babesia. When people have electrical shock like pains in the body that accompany skipped beats, tachycardia, shortness of breath, ear pain, tinnitus, gripping chest pain, calf cramping, occasional night sweats, severe anxiety, hair loss, bruises easily, nosebleeds, sharp pains in the chest, we are looking at Babesia, people.